Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Pregnancy loss can leave us with so many unanswered questions, especially the one that so many of us always come back to. Why did this happen? Today, I'm talking with the founders of Reticular, a company using genetic testing to help individuals and couples better understand the genetic factors that may play a role in pregnancy loss. We talk about the science behind their testing, what we're learning about genetics and pregnancy loss, and how having more information may help families feel more informed as they think about future pregnancies. Hello, everyone. Today I'm here with John and Christina from Reticular. Hi, guys. Thank you so much for joining us today.
Hey, Sarah.
Good to be on.
Yeah.
So first, I was just going to ask if you could each just give kind of a little background about yourself and, what kind of led you to creating the company and, things like that. So Christina, do you want to go first?
Sure, of course. So I'm Christina. I'm a board certified genetic counselor by training and also the chief product officer at Reticular. As a way of introduction, my career has really spanned in reproductive genetics, and I've had a lot of past experience working with patients, seeking fertility treatment, and also wanting to understand the role of genetics. So I'm really excited to be joining Reticular because we're helping serving families with a lot of unexplained loss and going through very difficult emotional journeys. So I'm excited to be able to help them with the process of naming the cause, sort of empowering them to lift some of that guilt and shame that comes with loss. And we want to be able to bridge that gap and see why unexplained, it doesn't always mean unexplainable. And we can talk a little bit more about the research, but really excited to be here.
And John, do you mind sharing a little about yourself?
Yeah, of course. So, hi everybody. I'm John, founder of Reticular. For me personally, I got into genetics because my dad actually, our family has this congenital heart disorder, and it was manageable throughout his lifetime. But my sophomore year of college, he had to get open heart surgery to correct some of these things. Thankfully, he made it through, right? And very happy today. But I think it was really crucial in understanding what I wanted to do with my life, given genetics is such a cause or has affected me personally. So we're really excited to use the power of genetics to understand and try to explain the unexplained here in fertility as well.
I'm curious, was that something that they knew before he was born, or was that something he was diagnosed with later?
Something diagnosed later. I'm Chinese. My parents, they grew up in 1960s China as just poor farmers. So they didn't really have genetics then, as you can imagine, right? Really not an access to any advanced medical machines either. Only I think once my dad got to college, he started to experience some symptoms that were more serious and explaining, and then got an ultrasound that explained, oh, it looks like your heart, the tricuspid valve or the bicuspid valve or tricuspid valve, which has three valves, is three flaps, is about his only had two flaps. Yeah, so it's really simple change, right? But really life altering. So yeah, it just really underscores the power of genetics.
With everything that I've learned and I'm continuing to learn about, genetics and just how everything has to go right, it's really a wonder that any of us are here today. It's like everything has to go just perfectly right. And one tiny little change can change so much.
Yeah, right. It is pretty incredible.
So how did you guys all meet and decide to start Reticular?
I can talk a little bit more about that. Yeah, so for us, we've always been focused. Me personally, started the company to focus on genetics specifically. And for reproductive genetics, we're really curious about just helping families have healthy babies, right? Today, genetic testing is really popular, right, in fertility. Compared to before the millennium, it really wasn't a thing at all. In the last 25 years, it's taken off, and for good reason. Today's standard genetic tests, they just count chromosomes, but just counting the chromosomes can explain up to 50% of early trimester losses, right? We're trying to explain the other half, where we're actually trying to read the genome and actually understand what genes do cause pregnancy loss and see if we can actually make progress there. There's been over 800 studies on other genes that do cause pregnancy loss, and yet there hasn't been a great way for patients to actually access this outside of being lucky living near an academic medical center like in SF or Cleveland or New York, right? So we're really excited to get an affordable product out that helps people access this. To answer your question about, how Christina and I met, I started this company really by myself, and we went through Y Combinator. I met Christina because, Christina's just got such a great background in helping patients, really connecting. She brings a lot to the team in terms of, that connecting the why to the impact of genetics in one's life.
I feel like I was just in the right place at the right time. Honestly, I've built my career, as I mentioned, in reproductive genetics. And so I've always that's my bread and butter. It's always been my interest, talking about some personal stories. I've also had, both professional and also personal interest in fertility. My parents had secondary infertility after having me, and they had multiple miscarriages, losses, 2, 3, maybe even more, and also went through IVF. All of them were unsuccessful. So I think that drove me to really have the empathy to understand what patients go through and why it matters. I previously was also working in other contexts and startups and clinical contexts and private practice as well. So it kind of all culminated into my role here at Reticular.
So this was the first time I really heard of a company that's like really trying to focus on the fertility and loss side of things. I mean, as you mentioned, there is genetic testing, but most of that is kind of a broad, for just anybody who's pregnant, not just people who are going through IVF or people who have had loss. So, were there just gaps that you saw there, or what? I mean, I know you've talked a little bit about what kind of led you to it, but what specifically about this?
So yeah, as I mentioned, there is a gap here, right? We know that we do testing for chromosomal abnormalities, both in the prenatal context. Those typically happen, during conception. It's not necessarily anything that you did. Then that explains about 50% of the pregnancy loss, specifically also early pregnancy loss. Now, what we're bringing in is looking at these single genes. And as John mentioned, this has mostly been in the academic research setting. So we're really bringing to head so that patients can benefit from it. So there is definitely a gap. And, we can go through some of the history of reproductive genetics and how research really translated into a test that's widely used. And we could go into some examples, but we're in the early stages and early innings of this particular type of way of analyzing both the paternal and maternal sources through this pregnancy loss panel that we have.
And now Reticular has two different kinds of tests, right? One for like embryo testing and then one for, like the pregnancy loss panel. Do y'all want to talk about, those two products a little bit?
Yeah, of course. So as you mentioned, Sarah, we're trying to meet every couple where they are. So, we know a lot of couples have not gotten to the stage where, oh, we're going to do IVF. So we're really excited to, just see we offer our panel, right? That just helps patients understand, okay, do I carry any of these genes that could potentially explain what's going on, right? And as we mentioned before, the literature shows that, oftentimes a quarter of couples will actually have these genetic variants that do actually explain things, right? And so by offering a product, just a really simple at-home saliva kit where you and your partner swab your cheeks twice, put it in a tube, ship it back to us for a really affordable price of $500 for both partners, $250 if you just want to do one. We're trying to basically just reduce the barriers to get this information. This wasn't really possible before. Genetic testing costs a lot of money, but thankfully through advancements in the sequencing itself, through advancements in the technology since COVID, when everybody was getting genetic tests, right? The prices have come down a lot, and now it's possible to actually serve this and make it easy to understand. That's on that front. I wanted to add one extra product that we are also offering today. So before IVF, many couples will often do a product of conception test. This is basically if you have had a loss, had a miscarriage, you can actually take that material and then ship it off to a lab, and then they can check whether or not your sample is chromosomally abnormal or not, right? Again, that is helpful, right? Over 50% of the POC cases are chromosomally abnormal, but still leaves, a significant fraction, really half of cases that aren't explained at all. And what we're really excited about is that studies are showing that really up to maybe 30-40% of these POC tests can actually tie back to a specific gene that's causing it. And so we're really excited to add another product that can help patients in the stage of product of conception before they do IVF. Finally, we offer this embryo report. This is the most advanced thing that we offer. When you're doing IVF, it costs quite a bit of money, right? 5-figure digit, maybe 20 to 30K per cycle. It's a serious thing, right? And so, our product, which is $1,000, can help you basically decide which embryos to transfer first. It's very common, over 50% of patients do the standard genetic tests in IVF, which count the number of chromosomes. As you can imagine, there's a bit of a theme here, right? But those don't explain everything. Up to 40% of transfers with chromosomally normal embryos still fail. It's a very common thing, and we're trying to fill that gap as well. And what's really actionable at the IVF stage is you can actually pick your embryo, right? And so by seeing if certain genes made it into certain embryos, right? Like it's kind of a lottery between what genes actually make it into what embryo. You can actually decide what to prioritize first. And that's like probably the highest impact thing that we can provide patients with our genetic testing.
So, like for instance, people who have known conditions that maybe standard testing wouldn't pick up, then you would be able to see like which embryos maybe picked up that and which ones didn't.
Yeah, exactly. So, I think you're mentioning like the health conditions part of our product. We screen for 24 plus health conditions as well, ranging from heritable cancers to metabolic disorders to heart disease and autoimmune conditions. And many parents who have those diseases running in their family take that very seriously. And, if they have enough embryos, would like to prioritize ones with a lower risk for that, right? At the same time, we also screen for basically genetic risks of pregnancy loss itself at the IVF stage. So some embryos will inherit some variants that have this higher risk, and therefore you can actually do something to avoid it.
So is this, I mean, I know obviously this isn't always something that can tell you what caused your loss, but is it, something that people who have had a loss can still, like do after their loss, even if it doesn't explain, what caused this particular loss, it could maybe give you an answer as to you have this could be a factor, like that kind of thing.
Yeah, exactly. That's kind of the main idea.
So in genetic counseling, we have this notion of screening versus diagnostic, right? So our test right now is considered a screening tool as not necessarily a definitive diagnosis. For example, John talked about the common conditions that we also looked at, the 24 plus gene conditions. So that basically looks at how you compare to the general population in terms of risk. So even if you have a higher risk, that doesn't mean necessarily that you will definitely develop that condition. And similarly, for the pregnancy loss genes, even if there was a positive variant, it could be necessarily associated with pregnancy loss, but it could also result in a healthy pregnancy and healthy baby. But the whole point of screening tool is to be able to allow us to give more information from the beginning, especially for patients going through IVF and have this ability to prioritize which embryos to transfer first.
I guess I can also add on a little bit. You mentioned that we can actually identify some sort of cause oftentimes as well. So thankfully, scientists are really great at understanding what these different genes do. So for example, one gene that's very common in pregnancy loss is called tube B8. Kind of sounds like R2D2.
Yeah, like sounds like Star Wars.
Yeah, it really does. Yeah, and that gene, it's a very physical thing what that gene does. It's basically like, it's kind of like when constructing a building, you need to put up the structure first, these metal beams ahead of time. And 2BA is basically involved in the metal beams supporting the cell, helping it grow, making sure that it can grow to the right size, right? And when there's a mutation in that, then it can often, arrest the egg and just prevent it from growing to a large enough point such that it can properly develop, right? So that's just like one example of one of these genes. There's so many other genes that I could talk about, but I think, giving some sort of color to why this is happening and how it's really just like a physical thing. It's not like, anything else, I think is really interesting.
Well, and as you know, I think Christina mentioned earlier about unexplained infertility, a diagnosis that gets thrown at a lot of people, but I mean, it can't be unexplained. It's just we don't know it yet, or we haven't,
Yeah.
found the reason yet. But things like you're talking about could be some of those cases that are just being diagnosed as unexplained.
Yeah, exactly. And I don't think they're really unexplainable. It's just that there's like not that much attention from scientists on this topic. I know it sounds a bit ironic coming from me, given I'm a man, but women's health is overlooked. And the other factor that's really making this possible is that genetic sequencing costs have come down so much. And so you have larger studies. Before it was just like hundreds of people in a study, and you can get some information out of it. But now we're starting to do genetic studies on the orders of hundreds of thousands to millions of people because you can sequence people at large like we did during COVID, right? So for the first time, this is now being possible. Unfortunately, the genetics community really is focused on these diseases primarily rather than fertility and pregnancy loss. But there are a few scientists, a few labs throughout the US that are working on this and charging ahead. So we're really excited to, make that happen and bring it to patients too.
Yeah, I remember we lost our daughter Jasmine. She was stillborn at 32 weeks, and we found out that she had mosaic trisomy 15. And they told us, it's just a random chance, like a less than 1% chance of it happening in your pregnancy. We did meet with a genetic counselor, but at that point, they're like, the cost of this would not be worth it to you, to get you tested or your husband tested to see if it was a genetic issue or not. So I mean, I've definitely been up against that cost and having to decide, like, would this really benefit us? Would it really give us any closure on anything,
Yeah, we've heard a lot of stories about this as well, like people who have gone through similar things, especially given genetic testing, it really has to come out of pocket for many patients, right? Like it's not something that's covered like it is in other conditions, right? Everything in fertility just has to come out of your own pocket. So yeah, I think that's why we really wanted to make it as easy as possible to use and as affordable as possible. We've just done some like statistical magic on the back end to like make sure to make the product work at such a price point and such an ease of use. Yeah, that's just top of mind for us. Yeah.
which I really appreciate because yeah, when I saw the price, I was like, I would pay for that. Just it's, I mean, as I was talking to Kendall about it, and when he told me the price, and I'm like, wow, that's the cost of what I would pay for genetic testing, anyways. Like now I forgot what the standard test in pregnancy is. The one you usually get around 8 to 10 weeks. I've had it so many times and I can't
NIPT?
remember. Anyways, whatever that test is, I paid about the same price.
A karyotype.
I guess, yeah. It has a name, but anyways. Yeah, so I paid, about the same price for that out of pocket. And, this test here that you've created would have given me way more information than what that test gave me because that test couldn't even, diagnose my daughter. So I'm
Yeah.
very appreciative that take price into consideration and have made it affordable for people. And if, we didn't go through IVF, we did do other fertility treatment, but if it had gone to IVF, I would have paid that, what's an extra $1,000 when you're already paying, $20,000 for a cycle? You want it to work, right? So do you have to go through a doctor's office to get the test, or can you just, get it on your own? Or does it work both ways?
For the panel itself, you can get it on your own. It's you can order it online. Also get this saliva kit and sample directly mailed to you. There is genetic counseling support. So within each stage of the journey, you can talk to me, genetic counselor, either before, during, or after your test to kind of go over what those results actually mean and then be able to that relay that to your care team and for them to essentially understand what it is that test that you received. So obviously with the embryo report and testing that does go through your clinic and also that we work with the existing PGT-A companies or the tests that do chromosome count to get the data. So there's a little bit more involved pieces in terms of logistics there. With a panel, super easy. We'll mail you the kit, you send it back.
How long do the results usually take?
Typically around 2 to 3 weeks.
That's really not bad. I mean, for genetic testing, usually it takes like way longer than that.
Yeah, we're partnering with a sequencing vendor that's, from they came out of GeneDx actually, which is they do whole genome sequencing for rare genetic screening, typically postnatal, right, for children who are already born, but they're very used to quick turnaround times. If you're trying to diagnose a baby in the NICU, right, you need that result like immediately, like as soon as possible, like overnight is like really key. If we did it overnight, it would cost like probably $2,000, but 3 weeks is a pretty good turnaround time that we've agreed on.
So I know you said that the genetic counseling is part of it. Is it something that you feel like other like fertility doctors or, just doctors in general understands like the results that and what they mean? Because I know that doctors can't know everything about everything. So I'm just curious, what I guess what their response has been.
Yeah, doctors are actually really excited about this as well. To them, they're already ordering a lot of tests on some of the things that these genes affect. So to paint a concrete example, for egg maturation, for example, doctors order hormone tests, they order imaging, they order ultrasound. All of these things cost hundreds of thousands of dollars already. And yet they still don't give a really definitive answer, right? And so they're really curious about how using genetics, reading the genome, rather than just counting the chromosomes, can actually help them with their workflow that they're already doing too, right? Another example is they testing placenta quality. That is a test that's often done in the clinic, and understanding what genes can affect the placenta, and maybe if there's a mutation in that is actually super helpful information for them as well. I think it just needs to be, that's how we've, really distilled it, trying to take all this genetic information and make it very clear in how it fits into their workflow already, so they can like easily communicate that as an additional line item to the patient.
And just a kind of random question, but how do they determine which genes are pregnancy loss genes? How do they go in and identify like which ones do what?
Yeah, of course. Well, there's a couple of ways. So you can do it in a top down or a bottom up way. So top down is probably the easiest to explain. At these academic medical centers like UCSF or Cleveland Clinic or NYU Langone, there's often these case control studies, basically, where you have a lot of couples with recurrent pregnancy loss will come into the clinic, and clinician will say, oh, we're actually trying to study genetic variants in RPL. Would you be interested in enrolling? And, because it takes so much effort and sequencing costs so much money before, they could only do it for so many patients. But this gives you signal that like, oh, for this patient population with RPL, compared to, people who have these genetic variants just have a higher risk, right, of this actually happening. Now, how do you actually try to pin down the cause? Well, you can actually try to understand the genes themselves. And that's from more of like a bottom-up approach. So obviously you don't really want to edit genes of human beings. So what you can do is you can basically test embryonic lethality in mice. So like if this variant is in a mouse, can they have successful babies? And actually the research on that is like much more ahead than the research on humans. There's like 3,300 genes that have been profiled in mice that have been shown to like be necessary for having a mouse to have a baby. And yet there's only 600 genes so far in humans. And I think it's just because it's still quite early. There haven't been that many resources dedicated to it. So yeah, I mean, it's really like, I know I come at it from a very scientific angle, but there's really so much left to do. And finally, we're at a point where we can actually bring this to patients affordably and give them these results. It's kind of like my passion, I guess.
Yeah, I mean, highlight the biological function. So if each of the genes, even if there's no definitive causal link to pregnancy loss, as John mentioned, like 2B8 is an example of that. Like we know it's a scaffolding biological function. And another gene that we know, for example, just to highlight that is WE2. I know these are alphabet soup here, but it's essentially when the sperm meets the egg, there's this like final switch to get it to an embryo state. And so that gene is a part of that. And basically, fertilization doesn't go through when even though everything looks right. So each of these genes, a lot of them, we mapped out some of the biological functions about, so why does it impact embryo rest? Why is there an early developmental issue? And yeah, that's the sort of ongoing research that's going on as well.
I mean, ideally, like our vision is to run a clinical trial for these genes. The only reason why there's no causal definitive evidence yet is because nobody's actually organized a clinical trial, spent the money, and monitored people over a period of time. We're really curious to do this because this has been done for PGT-A, this has been done for mosaicism. The findings of genetics and fertility just take a bit of time, right? So we're really excited to get started, continue collecting more evidence, and just bring it to patients and help them today too.
Yeah, and as so many people are affected by this, I'm sure there would be a lot of people willing to, participate and help with that research because again, there is not much on it. So yeah. Well, do you have any other plans? I mean, I know you have these products now. Is there anything you're looking at like expanding to in the future or, any other things that y'all are planning on doing as a company?
Yeah, I would say we talked a lot about pregnancy loss today. That's really one of our primary products. The other product that I think we briefly touched on is these health conditions, right? And screening for them ahead of time too. Another vision of ours that we'd like to make progress on is ending heritable disease, right? So I'm sure some people at home do have family histories of these diseases. I'll paint a picture, right? Today, you can screen for chromosomal diseases like Down syndrome or monogenic conditions, diseases that involve single genes like cystic fibrosis. But screening for diseases that involve multiple genes is just harder, right? Type 1 diabetes is a good example, right? That involves multiple genes. It's very heritable. And yet there's not a great model that can actually predict whether or not your child will have type 1 diabetes from their genomic sequence. So it's kind of like, our goal is to really build models that can actually do that. I'll be even more nerdy for a second. like today, the models are super small. You see, like, for AI, right? The models are very large. They take up massive data centers. I'm sure, everybody's heard about this in the news. And yet the models that we're using to predict heritable disease, you can actually train overnight on your MacBook, right? So it's like a big difference in the amount of resources, compute, and just like attention paid to this problem. So we're really excited to advance on that front as well. So we can do that and, take advantage of all the infrastructure being built out for LLMs, but actually applying it to solving disease.
Yeah, and I know another thing that I have is PCOS, or now I guess PMOS is what they call it now. But that's another one of those things I mean, I don't know if you would call it a disease or not a disease, it depends on who you're asking. But, that's what comes to mind when you're talking about things like this, because I have daughters and I wonder, like, is this going to go to them? Like, like things like that. So I love that you're, doing that and hoping that that also leads to more research for things like that and endometriosis and, other like fertility related diseases, I guess.
Yeah, I mean, we were like kind of, so, obviously we're just focused on our pregnancy loss product today, but, the same science that we're doing could be applied to actually discovering drugs for these fertility related conditions, right? Especially ones that are heritable, such as endometriosis. I think PCOS is heritable as well. I would have to look at the literature real quick. But then uterine fibroids is also a good example. Those are something that's very common, and yet it's actually very heritable, between 25% and 75% heritable. I know that's a big range. That's because it's just not very well studied either. If you guys are noticing a trend, yeah, like, because we know it's heritable, right? We know it's in the genes somewhere, right? And there's just hasn't been that much research and effort dedicated to actually understanding that basis. A lot of the, clinical solutions for uterine fibroids specifically, we looked into this a little deeper so I can speak more to it. Unfortunately, I haven't looked as much into the literature of PCOS, but I would be excited to do so. On uterine fibroids, a lot of the solutions are like not, they're just like symptom management, right? They're not really getting to the root cause. We take these hormone blockers to basically help with the heavier periods that are caused by uterine fibroids, but those have really bad side effects. And the moment you stop taking them, it just comes back, right? It really doesn't address the root cause of, getting rid of the uterine fibroid and from preventing them from happening again. And, that's what the really exciting part of genetics can do, right? It's just really understanding what's going on in our cells so we can try to engineer a solution, to sound nerdy about it.
No, but I think that's amazing. I mean, that it can lead to so many other like important things that will really improve, especially women's healthcare, which, as you mentioned, is often overlooked and forgotten about. And, people don't spend time on it because it's not as important as, curing cancer or doing all of these other things. But, I love that, that y'all are doing this and thinking about the bigger picture and, what else you can do because it can improve so many people's lives, really.
Really.
Is there anything else that y'all want to add about anything?
I think I want to normalize that infertility is actually a very common experience. It's just not often talked about. I think the recent stat is that about 1 in 6 couples within reproductive age have had or are going through a history of infertility. So we want to be able to build some products that would be useful for them as they're going through the journey. Obviously, there's, many other factors with infertility beyond just genetics, but we hope to be able to add that sliver of context for people going through this and sort of remove some of, again, the what can I do, what did I do wrong type of question, and really be able to say, well, actually, maybe there's genetic causes for that. And in the past, chromosomal abnormalities oftentimes, they usually happen during conception, so by chance. And that alone, I've seen in clinics, gives people a sense of better understanding as to what their experience goes like. And we want to be able to extend that also for single genes as well.
Well, again, as I said, I'm like super excited about everything that you guys are doing. And I was just so excited to, to see that chance come across to work with you guys, and, anything that I can do to help out going forward, happy to be involved in anything, and just looking forward to all the updates and, progress that you guys make. So I really appreciate you both coming on and sharing about yourselves and the company with us.
The last note is that we're here whenever your listeners may be ready to talk to us. So they can book a call free of charge and talk to me as a genetic counseling sort of support. And they can text us. We're available when they're ready.
And the easiest place to go would be your website.
Yeah. Reticular.com.
All right. Thank you guys so much again.
Yeah, really appreciate it, Sarah.
Thank you so much to John and Christina for sharing all this amazing information with us. I hope today's conversation helped you better understand the role genetics can play in pregnancy loss, and about some of the options that are becoming available for families who want to learn more information. One thing I really appreciate about conversations like this is that they give us another avenue to ask questions. We may not always get a definitive answer for why a loss happened, but having access to more information can help us make more informed decisions about the future and maybe feel a little less lost in the process. If this episode resonated with you, please consider sharing it with someone who might need it, or leave a review on Apple or Spotify. Thank you so much for tuning in, and remember, we are all in this together.